There's an urgent call for more to be done to tackle cervical cancer in Jamaica. There is concern that too many women are dying from the disease. Shamela Pullen reports.
Cervical cancer is now the second leading cause of cancer-related death among Jamaican women.
The cervix is the lowermost part of the uterus and it's found in the vagina. So it's the easiest part of the uterus. It's the only part of the uterus that we can actually see when we examine you. And we see it by looking through the vagina at the vaginal exam. So cervical cancer is where we have abnormal cells that are growing on the cervix. And these abnormal cells are growing without any control over them. So they continue to multiply, they can invade other organs around, and hence they are dangerous.
Data from the Ministry of Health show that over 390 women are diagnosed with cervical cancer in Jamaica each year. On average, over 180 women die annually from the disease. Consultant gynecologist and obstetrician Dr. Kathy Madan says this is quite significant for a country like Jamaica. But Dr. Madan says to tackle cervical cancer, more women need to start doing early screening for the disease.
So our young people or middle-aged people have to come in and do their well-woman visits. And in that well-woman visit, we do a detailed gynecological exam, including looking at the cervix to see if we see any abnormal areas. And we also conduct a pap smear at that time to see if we detect any abnormal cells. Because remember, cells are not things that you can actually see with the naked eye. You need a microscope. So we need to do this pap smear on a regular basis. And I think that's one of the first areas we need to attack.
And with the studies linking the human papillomavirus, HPV, and cervical cancer, Dr. Madan is encouraging more persons to get the HPV vaccine.
It accounts for 80%, more than 80% of cervical cancers that exist. And it's a virus that is out there. A lot of us have been exposed to it. And so vaccination has been shown to reduce the risk of acquiring HPV, as well as particularly the more virulent strains, the more dangerous strains.
Radiation and chemotherapy are usually among the treatment options for cervical cancer. However, if persons do their regular pap smears, they can detect abnormal cells early before it gets to the stage of cancer. Cervical Cancer Awareness Month is usually observed in January. With our health report, I'm Shamela Pullen wishing you good health.